Hello friends, myself Dr. Hariballabh Mahapatra, working as a diabetologist in Sri Hospitals Bhubaneswar and Sevayan Diabetes Center Puri. In this session we will be discussing about how to know if someone is having diabetes. We all have seen many patients with diabetes, and what happens when someone is diagnosed with diabetes? They usually have three major symptoms like increased appetite, increased urinary frequency and increased thirst. Additionally, some patients who are having uncontrolled blood glucose, they can have some amount of weight loss and easy tiredness can also be there. There are also people who present with delayed wound healing, and all these symptoms when present, then the subject should undergo certain amount of blood glucose test. 2 or 3 different types of blood tests are there, like the blood glucose can be done in the fasting or at the postprandial up 2 hours after breakfast or lunch. It can be tested. At the same time, the subjects can also undergo an HbA1c test. What do you mean by HbA1c? It's a type of hemoglobin to which the glucose is bound in an irreversible manner, and it shows the average blood glucose over the past 2 to 3 months, and it's a very valid and well documented test, and it carries much more importance over the conventional blood glucose test. And patients who are having higher amount of HbA1c can also be diagnosed with the diabetes only based on their HbA1c status. If the blood glucose tests are not available, then HbA1c itself is sufficient enough to make the diagnosis of diabetes. And there are two major types, you can say, although there are 4 different types of diabetes, but usually clinically what we see is type 1 diabetes, type 2 diabetes and gestational diabetes and other specific types of diabetes. Patients with type 1 diabetes, they usually tend to be of younger age, and those with type 2 diabetes, they are relatively older with some amount of obesity is there, and there is a long period of undiagnosed diabetes can be there in patients with type 2 diabetes. Whereas type 1 is explosive onset, there is a sudden rise in the blood glucose, that the child loses sufficient amount of body weight, and there is a substance called ketone in the urine. What do you mean by ketone? It's a substance which is excreted as a byproduct of fat